L4, L5, disc bulge, disc herniation, disc protrusion, disc excrusion. In this video, I'm going to teach you how to interpret your MRI report if you received an MRI report from your doctor or specialist saying they have an L4, L5, disc herniation or disc bulge. Helping you relieve pain, conquer stress, and supercharge your health the chiropractic way. Hi, welcome to this video. I'm Dr. Walter Salubro. I'm a chiropractor in Vaughan and the author of Back to Health by Choice. How to relieve pain, conquer stress, and supercharge your health the chiropractic way. And in this video, I'm not only going to teach you how to interpret and understand your MRI report, but I'm also going to show you how I would interpret it as a chiropractor in terms of looking at it from a structural corrective perspective, and also show you the kind of options you have truly to get that taken care of and treated properly. So what sparked this video? Well, I received a question from one of my viewers, and this is what she says. She's 25 years old. She says, Dr. Walter, I have a disc bulge with post-central disc excrusion at L5, S1 level, indenting the thecal sac and causing severe narrowing of bilateral, lateral recess, and neural foramina with compression of the transversing and exiting nerve roots. She actually quoted her MRI report, and she actually sent me a copy of her MRI report, and I saw that word for word. Then she goes on to say, I was asked to consult a neurosurgeon who said that surgery is the only alternative to cure the severe pain I have while walking and sitting. He also told that if I don't do surgery soon, chances are that my legs will get extremely weak in the future. Do you think I have any possibility of avoiding surgery in my case? I can really get where she's coming from, and I've seen many patients in my office that have back pain, leg pain, disruption in their lumbar spine, the lower back, and also damage to their discs. So first of all, let me show you what these terms mean, because these are very big terms on this MRI report, and it's good to understand it so you know how to position yourself in terms of what kind of options you have to take care of disc bulges, disc herniations. So first of all, what's a disc bulge? Well, if you look at a normal model of the spine, vertebra, the disc, nice healthy disc, thick, wide, fibrocartilaginous structure on the outside, very strong, with a jelly-like material on the inside, and it's well contained and it acts like a shock absorber. However, due to stresses and trauma and impacts or misalignments of the spine over time, the outer ring of the disc can get damaged and cause the inner part to essentially bulge out or herniate. So what does that look like? There's an example of degeneration along the actual vertebra. The disc now is narrower. You can see the difference. So this side here, healthy, low back, disc and vertebra. This side here, unhealthy, degenerated, low back, disc and vertebra. And if you look over here on the side, that is a disc herniation. Okay? So in the MRI report, this viewer says that she has a disc bulge with post-central disc excrusion. What that means is, so here's a lumbar spine, straight from the front, curvy from the side, that's normal. Again, an example of a disc herniation. What post-central disc herniation or disc bulge means, it means that the disc on the inside where the spinal canal is protruding straight back, centrally. So back into the spinal cord or nerves area. So what does it mean when it says that the disc bulge is indenting into the thecal sac? Well, your spinal cord, which is well protected inside of your spinal column, is actually surrounded by a tough membrane. The outer one is the most toughest one. It's called the dura mater, and the membranes make up what's called the thecal sac. And within that thecal sac, there's a bunch of fluid that flows from your brain down to your sacrum and back up to your brain. That's called cerebral spinal fluid. And the spinal cord, which, as you can imagine, is such an important structure that it needs to be well protected, because all the information that controls all of your bodily functions and all your organs and all your hormonal systems and your adaptability to stresses and your movement and everything in your body flows from brain through spinal cord to all your body parts and back up to the brain. That's where the flow of information and life goes through. So it needs to be well protected, the spinal cord. So it's protected by fluid inside the thecal sac, the thecal sac membrane, and also the bones on the outside, which are the vertebrae. So what else did the MRI report say? It said that there's bilateral, lateral recess. So this disc bulge is going not only centrally back, but also laterally to the outside, now closing up or compromising the openings where the nerves come out from. That's called the lateral recess, and the neural foramina is the actual opening where the nerve comes out from. So not only in this case is the disc going straight back, but it's also going laterally. And these nerves in the lower back, they go into the lower back region, they go into the legs down to the foot, and also go to the lower digestive organs, the colon, and the pelvic organs, sex glands, and bladder, and so forth. So it's an important area. If there's a disc bulge that's irritating the nerves that goes to those body parts, it can trigger leg pain, sciatica, possibly digestive issues, or even problems with internal organs in the pelvic region. Now, as a chiropractor, when I see an MRI report like that, I want to see what the structure of the spine looks like, not just from the soft tissue perspective, which is what an MRI tells us, which is good information, but I want to see it also from an alignment perspective on plain film x-rays. Because you need to understand that if you have a disc bulge or disc herniation or damage to your disc or degeneration on your spine, what that tells you and me, it tells us that this damage has been existing for a very, very long time, regardless of when the symptoms appear. Sometimes the symptoms appear immediately, sometimes the symptoms appear later. But when there's that much damage, especially degeneration damage and disc bulge or disc herniations, that's been a problem that's been persisting for a very long time. So the next question I ask as a structural corrective chiropractor is, what caused the disc bulge or disc herniation? Was it trauma? Was it an impact? Was it poor posture over time? Was it a shifting or misalignment of the spinal structures, the sacrum, or the pelvis? I mean, check this out. Here's a spine, the low back, it should line up straight. Well, what if the pelvis or the sacrum is tilting, causing the spine to tilt? Or what if the curve of the spine actually lost its shape? Well, that will actually compromise the integrity of the lumbar discs, causing damage to those discs, wear and tear and degeneration over time, or disc bulge and disc herniation. So as a structural corrective chiropractor, I would assess the structural alignment of the complete spine from top to bottom with a focus in the lower back pelvic region. So what are your options if you have disc bulge or disc herniation? Well, if you go to a medical doctor or a medical specialist, they will give you anywhere from 1 to 3 options. 1, medications, which I'm sure you probably started there already. Well, my question to you is, if you take medications, what will that do to correct the problem that's causing the disc bulge, the structural misalignment, or the damage to the spine that's causing the disc bulge and that arthritic degeneration? Not much. It will actually do nothing. Maybe numb the pain, but that's about it. Another option they may give you is physiotherapy or some kind of therapy or exercises. That's good. That has some merits. It'll help you cope with the inflammation, help you relieve pain, get mobility, strengthen muscles. But again, a physiotherapist does not work on realigning the spinal structures, which could be contributing to that disc bulge. Third option is, like in this case, in this young woman's case, is surgery. I'm afraid that sometimes some docs will jump to surgery, possibly sooner than later, without looking at all the other options. And I've had many patients in my office as a chiropractor that were given recommendations for surgery with disc bulges at L4, L5 in the lower lumbar spine. And yet we've been able to help them conservatively with corrective chiropractic care, spinal correction of their spine, and also some specific exercises that we give them to take home and also do in our office. So in other words, surgery was prevented for them and they're back on their feet and they're walking absolutely great. So those are the options that a doctor will give you: medication, surgery, therapy, or physiotherapy. However, as a chiropractor, what I would do is focus on correcting the alignment of the spine, stabilizing the spine, and restoring good function and motion and stability to the lower back. So we're actually eliminating the causes of that disc bulge and restoring proper structure and function to the spine, thereby preventing surgery and alleviating all kinds of pain and getting you back to your normal daily function. So I hope you found this video tutorial useful. If you have any questions about your MRI report or disc protrusions or disc bulges or possible recommendations for what you can do or a chiropractic perspective of that, leave them in the comments below. I'll always answer all your questions and comments. Also, if you found value to this, click the thumbs up on below the video. Share this with someone that you know will find value with this, whether it's a family member or a friend that has back pain, leg pain, or disc bulges. And of course, subscribe to my channel below because you'll get more of these tutorials like this in the near future. Hope you enjoyed this, and I'll talk to you again soon. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.